Lipolysis is the medical term of the breaking down of fat. It can happen in a number of ways, from dieting to exercise or surgery. When you are not eating or you are exercising, your body must draw on its internal energy stores. For that, fat is broken down inside fat cells to generate energy by a process called lipolysis. During lipolytic processes, triglyceride in white fat cells are hydrolyzed to the end product glycerol and free fatty acids, which is delivered in bloodstream and metabolized in other tissues. When we eat a lot of food, our body will store the excess food or sugar in the form of fat in the adipose tissue. Look at the picture. Here you can see the adipose tissue is composed of adipocyte or adipose cell, or you can say fat cells. In this cell you will find the fat droplet. Of course, the main role of this tissue is to store energy in the form of fat. When our body needs this energy, the fat will break it down to give us the energy which we need. But when you will eat too much food, a lot of fat will accumulate, compromising lipolysis, which will cause obesity, which is a real health problem. Look here in the picture. You will see how many diseases are connected with obesity. You will see see diabetes, some liver disease, coronary heart disease, high blood pressure, high cholesterol, stroke, and obese people usually die 10 years before normal people. People who have fat on their stomach are more likely to get diabetes and have higher blood cholesterol level. But how can you know if you have obesity or not? In general, we have two ways to measure the health and fitnesses. The first one is body mass index, and the second one is body fat percentage. Body mass index is a measure of a human body shape based on weight and height. So in body mass index, they divide weight on height per meter, so they can know if you have too much weight, you have, or less than normal, something like this. But body mass index doesn't distinguish fat from muscle. The second way is fat percentage, which is more accurate. Why? Because in fat percentage, we know how much do we have fat, how much do we have muscles in our body. So it shows exactly how much do we have, our body is made up of fat. Look here in that chart. In this chart, you will see your body composition of fat, and you will know if you will consider you have obesity or if you are normal. First of all, look here in the beginning of the table. You will see the essential fat. You will see that women need at least 10 to 30%. Of course, because female body is different from male. You have breast, you have something like this, and we all know the fat is very important for all, male and female. Fat is important to store energy, protect organs. It's also essential for hormones. It's not only for store fat. It have many benefits in our body. But if you have too much fat, like 32% in female and 25 in male. Now we are in the red area. We are obese now. We are considered as obese. Why we need to know the fat percentage? Why we need to know the percentage of fat and muscles? Look at this picture. You will see 5 pounds of fat and 5 pounds of muscle. As you see here, the fat take more space than muscle. The muscle is more compact, so it take less space. And the muscles burn more calories. So this 5 pounds of fat burn only 20 calories a day. But the same amount, the 5 pounds of muscle burn 25 calories per day. So look here. So muscle take less space and burn more calories. Look here. Look here the picture. We have two guys. One has a great body, athletic body, and one is fat. But take this price. Both of them have the same height, the same weight, and the same BMI. Okay, how? The answer is because the one with the athletic body, his body consists from muscles, more muscles than fat. But the fat guy, his body consists from fat. So most of his body is fat. Okay. So for that we need to know the fat percentage, because the BMI not always can give us a exact result, a good result. The second thing is doing exercise. You need to do exercise regularly. The medical advice 30 minutes per day or 150 minutes per week. Start by walking if you have not exercised regularly. Then you move to longer and more various walk or more strength activity like jumping, bicycling, something like this. But what the best fat breaking down exercise? The best ever is to lifting weights, because it's improve body ability to metabolize fat and use it for energy, will also increase calorie burned after you work out. We see before the muscles burn more calorie. If you build more muscle, you will burn more calories. The second one, circuit training, which involve very serious exercise, training, cardio, or both, one after the other, with no rest in between. While it works similar to high-intensity interval training, the fast piece of this workout keep the heart rate elevated, allowing you to burn more calorie and use fat more efficiently to fuel your body. It also contribute to afterburn, allowing you to burn more and more and more for hour after you work out. But sometimes diet and exercise are not enough. There is always areas in our body resistant to diet, resistant to exercise, and sometimes we get tired from dieting and exercising. So there is many cosmetic medical techniques are used for reduction of subcutaneous fat. which subcutaneous fat is the fat under the skin. We have ultrasound lipolysis, is non-surgical, produce, is very effective, safe, simple. We have also laser lipolysis, eventually new liposculpture producer for removal of fat. For example, we can use it for the double cheek problem. Look here, the picture. Before we have a chin with a lot of fat, but here we have, but after we have a very nice one. We can of course use it for area resistance to diet. It's very good technique. Is safer than the traditional liposuction. We have also injection lipolysis, which is controversial cosmetic produce. Why? Because here we have a drug mixed and injected to the patient, to the goal of breaking down fat in this area. Okay.